It's not the greatest situation, and I consider it to be, it's almost like a cartel though. The government, insurance company, hospitals, a cartel.
Right.
And we little people are just kind of left out in the cold on that one.
Are you aware that if you have no insurance, you will be paid, you will be charged 4 times more than what the insurance company would pay for the same procedure as an uninsured?
Yeah.
Documented. So what it is, your insurance program is basically protection racket using extortion and racketeering. Now, I said that in front of an insurance lobbyist in Washington. He got white and angry. I said, I can prove it. And he would get very angry. I said, listen, you do the shakedown. You go to the doctors and say, if you don't join my insurance group, we will force you out of the market. You will not see another patient. He gets a cut. He has to take a huge hit. And the salaries go right to the executive, makes $25 million to $35 million, right to the stockholders. And the amount of money that actually goes to the patient for patient care, less. And they play with the books as well, so that the costs benefit.
Yeah, the answer to insurance is that people should be able to buy the policy they want, with the coverage that they want, with the deductible they want, from the state they want. Real competition. And not have this thing that where the government mandates that. In New Jersey, there's something like 68 mandates that have to be covered by insurance. In vitro fertilization. I mean, there's lots of things that are forced to be covered. And some people don't want to be covered for that. So why are we forced to pay for what we're not going to be covered for?
And I was born in Newark, 1951. I was in an Italian neighborhood. We had a doctor, I still remember his name, Dr. Risley. Dr. Risley used to come to the house with his little black bag, and if I was sick, he would check me out, and he would say to my dad, well, let me check out the other kids while I'm here, and it would be $5.
That's right.
Now, granted, my dad made $90 a week, okay, but he did, as you were saying, he gave the medicine.
That's right.
As well.
That's right.
And you were treated at home.
I remember the same thing. We had the same thing. Yeah.
And that's what I would say. What happened?
What happened?
How did we go from that to where we are today?
Well, how did we go to that? We moved my 90-some-year-old grandmother up from Florida back to Jersey. My mother, who knows how to deal with this because she's dealt with it with my other grandmother before she passed away and doing everything for her down there. When she came up to Jersey, she literally has a quarter of the coverage that she did in Florida for 4 times the amount.
That's right.
Why?
That's right. New Jersey's got a lot of fixing to do, and that's why I'm so glad that we have these Tea Party.
What I suggest that we do is we put a free clinic in Sweeney's backyard and say, Sweeney, Senator Sweeney, how would you like to
put it in the backyard? You got to put it in Norcross's backyard because he's the one who controls everybody.
Okay.
Well, we actually, now let me just tell you this is, I guess we can say this. One of our strategies is at this point going to inner city black churches and minority churches. We had standing room only in the last meeting.
They love this idea.
They love this idea. Do you want to know how to get your minority vote? Or 98% Democratic vote? You can preach to the choir. You guys are all there. Right. You were there to begin with.
Right.
You put in a good, honest clinic in their backyard where they are cared for and nurtured, they'll vote for you.
That's right.
Don't waste your millions on the choir. Put a free clinic in their backyard and tell the governor, who's an attorney, who practices law, defends doctors, doesn't want to see this system go away.
We don't really know that, John.
Well, we presume. But you have to let him know, and you have to let the Democrats know, because they're going to say, hey, the trial attorneys are our #1 contributors.
Yep.
We have to tell them, look, either go bankrupt, or we can save the state $5 billion, balance the budget tomorrow, and drop your property taxes, because this would also, if I don't have to worry about being sued, I would order 30% fewer tests, 30% fewer hospitalizations. That would save Medicare $200 billion That was a study done under Bush.
And all insurance would go down.
All your insurance premiums would go down. So this is a very large issue, and you guys have to be the soldiers. You got to get this out.
You're talking about bills. We had a bill for $52,000 from a hospital. Medicare approved $22,000. So if I didn't have insurance, I'd be paying the $52,000.
There's even more striking things like that.
Oh, yeah,
Like a baby delivery. If you go to the hospital with no insurance, you'll get a bill for $25,000 from the hospital alone. Plus, the doctor might be $10,000.
No, I have to laugh.
And
You said that. 1971, they double billed. My mother went, When I was born, my mother worked for the county.
Yeah.
They sent the bill. They sent one to the insurance where my father worked. If they didn't catch it,
Both would have gotten paid.
Insurance would have paid on it.
But the thing was that Blue Cross Blue Shield, now they're saying $25,000. Blue Cross Blue Shield pays $5,000. That's why we call it organized crime. I mean, you're paying for protection from that $25,000 bill.
Lawfully would probably be cheaper.
It's not real. It's not a real bill.
I'd rather deal with it.
That's what I was going to say.
They're paying the
Deal
full
with one guy.
I-
Pay off one guy.
Tony will protect me. But
As
this,
a question, just this popped into my
Oh,
mind
God.
because my grandmother, again, taking a flying Willenda in front of Perkins in East Windsor, is with the malpractice. I know, like, the ambulance squads, the volunteer ambulance squads, would they also have some of that same benefit with the no malpractice?
oh, sure.
I think if we solve the problem of taking care of the poor, and it should be a global thing. Everybody who contributes in some way to taking care of the poor for free should have some kind of protection. All we're doing is protecting. And I consider that malpractice premium kind of an illegitimate bill I was stuck paying anyway, because it's just, somehow our society has gotten so coarsened by the thought that any little thing goes wrong, it's the doctor's fault. Right now, I'm being sued. I just find this so incredible. 18 years ago was the last time I saw the patient. He's now 78 years old and has colon cancer, suing me. He says I didn't do colon screening.
What?
And the lawyers are taking it seriously.
And he's suing her because she didn't, and she's suing me too, because the man apparently couldn't function sexually at 78. We were getting him Viagra when he was 60.
Yes.
So, for free.
Yeah.
We treated him for free for many, many
Right.
years.
But that's it. You don't have to get more specific, but anyway.
Sorry, guys.
Just the whole thought that we get sued now for not screening for something.
Oh, God.
And the responsibility is totally taken away from the patient. And I think we could get it back. And I give that book out, that little blue book. That's now my defense. I
Well,
say, look, I tell you what you need to do to stay healthy.
Well,
Read it.
everybody assumes that the human body is like an automobile, that they're going to come
Right.
in and replace the carburetor.
That's right.
Take out a couple screws, and obviously it's not.
And especially if you don't change the oil all the time, it tends to
It's
deteriorate
just a
faster.
tiny little bit more
Now,
complicated than that.
Let me just tell you
Absolutely.
something that's
That's
called
what I
gain
did.
sharing. This is what's coming down the pipe. Be ready for it. Gain sharing is a very, very corrupt practice. What is coming down under Obamacare is accountability care system, where a doctor will be part of a medical home, okay, a hospital. And this vertical network, he's got to be a member, a part of it. And if they make money, if your doctor orders fewer tests and they have fewer admissions and fewer hospitalizations, the profit that that group gets, they will disperse it among the physicians.
Right.
The less they do, the more you make. Okay? Now, here's the problem. I have a patient who's non-compliant. Still smokes, still drinks, does drugs, complicated diabetic, heart disease, strokes. Will I want to see that patient? That's going to be dollar bills. It's going to come out of my pocket. I'll say, I think you better find another doctor.
And it's a sad system when doctors now don't want to see sick people.
So you will see doctors skimming and saying, no, I will only see the healthy ones.
Oh, God.
And you will see the doctors saying, if you're not healthy, I don't want to see you. And worse yet, the doctor, if the hospital is a good hospital and sees high risk, and loses money, the hospital will charge the doctor for money and give him a bill. So that's what's coming down.
What
It's
is
called
that?
gain sharing.
2014? or
And
is
that
this
is-
2014.
And that is a
It has to be
very, very
repealed.
corrupt.
Sounds like something Al Gore.
Obamacare has got to be repealed.
Carbon credits.
reminding me of that
for
Presbyterian
medical
commercial, the little girl that all the
Oh, yeah.
orphans
Wow, that's an amazing story.
One question on the cards. Where do you think we should get these out of? What's the most effective place?
Just your friends, get them to just say, hey, look at this, go to the website, and read up
Okay.
about it and sign up. Anybody.
Okay.
And then get your assemblyman, your congressman.
I have a whole box I'll leave with you
Okay.
of those, because just give them out freely.
Do you mind if we make copies?
Oh,
No, you can. No, just take what we've got
take
too.
what we got, we'll give
Yeah,
you
make
whatever
copies,
you
yeah,
need,
not
just
copyrighted.
drop 'em off.
Okay.
It's information. Get it out.
I'm sorry I'm hitting
I'm
you
going to
with
be
these, but
somewhere tomorrow where there's a whole bunch of senior ladies that are in this
Yeah.
women's group that they'd probably be very, very interested
Yeah.
Probably scan it and put it on the
Hypothetical.
website.
in. Actually,
You
on
and your
their
free
website,
clinic.
most of that.
Or just
have
link, yeah. just
an
link.
individual comes in and they're, I don't know when to use a really word, but say undesirable. They don't want to work, they just want everything given to them. Will you continue to see them? Or
Yeah,
will you
what we
put
do
out
is we
some-
get people and start nudging them and saying, come on, let's get going. You shouldn't be doing this. The other thing we have is people, as they get back on their feet, they still like the free part. And so it's a challenge to get them to say, okay, now, in fact, I'm trying to figure out what kind of sign to put up to explain that this is here for when you're in a hard spot, but as you get better and you get
It's
a job,
safety net, not a
we
habit.
want you to come to our practice, because that's the only way that we can survive. We got to
That's
get
one of
paid
the
over here.
problems with welfare. I mean,
Yeah.
Generation after generation.
But see, we're really happy to have people get out of it, whereas the
Yes.
welfare system, the caseworkers need a lot of people on
They wanna
welfare.
keep 'em in.
Right.
Now, here's
So it's
another
different.
thing. One of the things that I am very interested in is setting up a completely different residency program and board certification program. Totally different. I believe all our programs are hospital-based.
Yes.
Most inefficient. Doctors are trained, I was trained in general surgery and in family practice. We were both trained as also pharmacists, so we've been around the system. I know that the hospital system where I was trained isn't really what I do in my office. We need doctors who are board certified in what we call community medicine. Freestanding clinics would board certify that doctor in community medicine. Why is that so important? He would be certified in public health, social work, as well as in medicine. Why? Because a lot of the people come with complicated family histories, with generations of abuse and issues that are going on. We need to be able to deal with case studies. Do you know that 70% of all illness is self-inflicted, behavior-driven? How can I be responsible for what I can't control? So what we have today is we are now making plans with a local seminary. They're actually sending their seminarians to do the intake on our patients in the clinic. And they are saying, this makes
Now-
sense.
To hear their story.
Because we want to see the story. We're going back 1,000 years from when the Great Plague took place,
They're like social workers.
when the priests were also doctors. Now the priests are saying, oh, wait a minute, why not go back? Wasn't Jesus the great physician? For Pete's sake, let's try this thing again. If we're behaving badly, is that not a fair of the heart, spirit, community, network?
Yeah, they want to make doctors responsible for people not smoking when we're not there 24/7. The community is. So support groups to help people stop smoking or drinking or whatever is what people need, not a doctor visit every 3 months. That's not going to do it.
You should see Alita and a just liberal woman. They were at it and a plane. And she was sitting. My father was taken care of by the welfare system, and by the end, the two were hugging each other. And she says, "This is wonderful." She says, I got to bring this to my Jewish community. They need to see this because this is what we need." And it's the liberal mind starts to think, hey, wait a minute. It's a virtue to be generous with your money, not with someone else's money. It's a virtue when you give your time, not someone else's time. That's called virtue. Thank you.
Any more questions? Good.
Well, I'd like to thank you very much for your time. And I'd like to thank Bruno for recording it.
Thank you, Bruno.